Hello and welcome to another amazing webinar from our virtual event series of OneAquaHealth project. My name is Alexander Nikolov and I'm working for Synergy GmbH based in Vienna, and we are coordinating the dissemination communication work package. Over the next 90 minutes, our colleague and friend Oscar Tamburius from the National Research Council of Italy will guide you through the digital foundations of the OneAquaHealth project. The session introduces how the One Digital Health steering wheel and fair-based digital tools work together to create transparent, connected, and actionable data. Before we continue with our today's agenda, I would like to highlight our today's housekeeping rules. Namely, our virtual event will be recorded and posted on the OneAquaHealth Open Information Hub in order to ensure, according to the rules of open access scientific information, that all collected insights are openly accessible for all interested parties and can support further development activities in the field. Feel free to ask questions anytime in the chat option. We'll do our best to answer them during the event. That being said, I would like to pass the floor to Oscar. Oscar, please feel free to share the screen from your side.
Welcome, everybody again. Thanks to all of you for taking part to this webinar. As Alex was saying, today we'll go over the a narrative about what One Digital Health is. So from the concept, the original framework of One Digital Health to the enlarged concept of One Digital Health ecosystem. We will move between the first and this last points through the organization of the tasks of the project OneAquaHealth. It is important because thinking about the task 3.2, it is not really the task where One Digital Health was applied. Actually, it is a sort of a preamble that is necessary to introduce some elements that will be reconsidered during the webinar, and they will be important within the concept of One Digital Health ecosystem. Then we will go in depth in task 3.2, where One Digital Health actually lies, and we'll speak about what is the One Digital Health intervention, so the theoretical methodology, and how it has been deployed so far in the first iteration with the OneAquaHealth project. In the end, we will also go a little more in depth in one of the main pillars of the One Digital Health, because it's about everything at a time, and the Q&A moment in the end. That's okay. So what is One Digital Health? The core concepts are this. It was introduced in February 2021 with a position paper on the JMIR Journal of Medical Internet Research, co-authored by me, Ariel Benis, Anna Moen, and Catherine Kronaki. We are all part, by the way, of the OneAquaHealth project. One Digital Health is a novel scientific framework and research field. Its main goal is to achieve a unified approach in order to a digital interpretation of the existing relationships between human, animal, and environmental domains. So in a nutshell, consider One Health. One Health seeks for a balance between the actions performed into the three health-related domains: human, animal, and environment. Every action implies information. This information are conveyed by something that we call digital object. We will see them a few slides later. The balance between such information, or better, the balance between the digital objects coming from the information that in turn come from those activities, is where One Digital Health lies. It took me 3 years, by the way, to arrive to this nutshell. Anyway, this framework features two keys: the One Health on one side and the digital health on the other side. Consider that in the last 20 years, the raising importance of One Health and the raising intertwining dynamics with the as well, raising digital health importance, brought to new kinds of disciplines like infodemiology, digital epidemiology, and so on. So One Digital Health is also part of this offspring that comes from the encounter from these two sort of parents. We then have three perspectives. We have the individual, and individual is not necessarily the human. Individual is every individual entity, be it either human, an animal, and an environmental entity. Then we have the population as a class of individuals, and then we have the ecosystem, that is everything that lies surrounding the individual. So ecosystem is not necessarily the environment. We will see the environment in the next slide. And in fact, the most external circle of this framework is the one with the 5 dimensions. We have the five main ways through which the main concepts that are origin into the 2 keys and are filtered by the 3 perspective can be operationalized in some way. So we have the citizen engagement and the education, and we do know about citizen engagement in OneAquaHealth because of the citizen science. We will see more specifically the concept of education in speaking about One Digital Health intervention. Here we have the environment as the set of nature-based solution. We have the health, of course, of human and animals, human and veterinary healthcare, and last but not least, of course, the healthcare industry, so healthcare 4.0. But the operationalization between the perspectives and the dimension is made possible only via what we call the technology ring. The sort of a fil rouge is the whole set of technologies. We will call them digitalities, and we will see they make it possible to translate some from the theory to the practice. And all in all, this is what we call our framework, the One Digital Health steering wheel. In fact, you can see it resembles a steering wheel from a car or whatever vehicle you can think about. Okay, so let's briefly dive into the task 3.1. According to the declaration of the OneAquaHealth project, the work package, these are all the objectives of the work package 3. In particular, the task 3.1 was focused on the reviewing the best practice, health and well-being indicators, databases of indicators, urban public health and environmental data services, and so on. So the main outcome of the work package 3 via the task 3.1 was a timely list of selected human health and well-being indicators to be coupled with the a list of environmental indicators coming from the work package 2. Why did I mention this? Because within the OneAquaHealth project, we selected human health and well-being indicators from the 5 research sites, Benevento, Coimbra, Ghent, Toulouse, and Oslo. It was important to try to address all the issues coming from the 5 countries in having the possibilities to access this information. It was important to collect these indicators because it was necessary to operationalize the One Digital Health framework, focusing on the dynamic relationships between human health and human freshwater ecosystems. In fact, one of the most important branches of the OneAquaHealth projects in the world was and is to try to find some statistically meaningful correlations between what the outside environment says and what the human and animal health side say. It was important to gather this collection of indicators to provide a quantifiable and integrative foundation for evidence-based intervention across the work packages activities, and last but not least, to feed one of the pillars of the One Digital, the broader concept of One Digital Health ecosystem we will see by the end of this integration. So keep that in mind, One Digital Health ecosystem. And gathering these indicators, it was as well important because it allowed us to highlight the existing connections between the ecological determinants of health, coming mainly from the work package 2, the social determinants of health, coming from the work package 3, so the human health and well-being, and work package 4, the citizen science. And it was as well important to find connection between these determinants and the digital determinants of health. In the current European legislation, in the current European digital legislation, the digital determinants of health have come across a first order of importance. So it was of utmost importance for us to understand if and how some connections between the ecological side and the social side could fit into the digital side of healthcare. In fact, it spans across work package 2, 3, and 4, and try to understand if and how such connection could fit. What are the main outcomes of the OneAquaHealth project? That is exposure, vulnerability, and resilience in urban blue-green environments. So we have been trying to gather indicators. We have been trying to find the links with the public accessible, of course, data sets. And we have been trying to organize them in some sort of levels and layers, classifying them via the categories of social and ecological determinants of health. We have been trying to understand the connections between those indicators and the layers of the One Digital Health framework, so the keys, or better, the perspectives and the dimensions, in order to find out an alternative way to characterize them also under the digital determinants of health perspective. So in order to provide a new way other than what the European Parliament already says, I repeat, specifically for our point of view. It was necessary to create some of the fundamentals for the One Digital Health intervention. Okay, so let's shift from the task 3.2, task 3.1 to task 3.2. So we're back to the declaration of the project. Within the work package 3, task 3.2 main objective was this: to establish some fair processes, fair meaning fungible, accessible, interoperable, and reusable processes for data generated in the project, and a fairness assessment, that is the compliance of digital objects with the fair principles for all the digital objects generated into the project, and to validate some metrics to align them with the One Digital Health approach. So this meant to perform a periodic and incremental process of fairness assessment of our digital objects, and arrive, of course, to understand if and how the digital objects produced time after time within the project could be part of the concept of greater concept of One Digital Health intervention, and try to understand if the OneAquaHealth project not only could be balanced in terms of actions, so One Health, but also balanced in terms of digital objects and information related to this under the One Digital Health perspective. So this was our deliverable 3.4 that was submitted on April of 2025. It was the first main outcome of the task 3.2, and the first steps towards the One Digital Health intervention lie into this deliverable, and specifically the FAIR data maturity model and the main results of the FAIR assessment. Yes, because in order for us to understand if and how some digital objects could comply with the FAIR principle, it was necessary for us to have a specific dedicated tool, which is called FAIR data maturity model. Well, we have into literature many FAIR data maturity models. Still, it was necessary for us to design a FAIR data maturity models that, on the one hand, could leverage all the positive aspects of the other FAIR data maturity models already part of the literature, but on the other hand, a model that could fit with our perspectives, with our goals, our objectives, and mainly a model that could be usable in terms of education, because OneAquaHealth is a One Health project, so we have different kind of researchers from different research fields. So not all of them come from computer science or better and health informatics, a biomedical and health informatics field. So it was important for us to provide them with a tool. They make them capable of better understanding the data that they produce in their own scientific environment, in order to make them capable to shape those data in a way that they can be more findable, more accessible, more interoperable, and more reusable. This is not a trivial thing to be addressed. Okay, so what are these FAIR principles? The FAIR principles have been formalized the first time in 2016 by Wilkinson and a bunch of co-authors, and this is extremely cited paper, by the way. So these FAIR principles, as you can read, intend to define the minimal set of related but independent and separable guiding principles and practices that enable both machines and humans to find, access, interoperate, and reuse data and metadata. If we can describe the data as the atomic part of the information, so the piece of information you cannot cut in turn more in depth, the metadata are the data that describe a data. So think about, for example, an electronic healthcare record. So you have the patient. So all the data related to the name, surname, the provenance of the date of birth, the address of the patient, those are all metadata, because are data that describe the data, which is the patient in that case. So the FAIR principles are necessary to make data capable to be not only readable by a human, but also and mainly readable by a machine. And I can leverage this point to anticipate you that after 10 years, now that we live within AI everywhere, now the next step is to have not only data and metadata that are machine readable, but data and metadata that are machine actionable. So the FAIR framework per se is now about to be in turn improved with other aspects that relay AI readiness, but it is something that we are currently working on, and that will be in that specific moment out of the scopes of this webinar. So just for you to know that from machine readability, we are witnessing the shift to also machine actionability. So what is a digital object I've been speaking about so far? Is any digital resource that allows capturing, storing, communicating, extracting, processing, visualizing, and spreading data, information, and knowledge. In our case, to support the development and the enhancement of components relatable to the layers of the One Digital Health framework. And specifically, for our purposes in the OneAquaHealth project, we have been considering as digital objects to be analyzed mainly data sets. So when I will be speaking about digital objects or data sets, the two expressions are interchangeable. Specifically, a fully digital object is a sequence of bits that represent an informational unit and that can be presented according to a FAIR principle. So a digital object is a way through which the information is sort of a packet. A free digital object is a digital object that can be machine readable. These are the three main data sets, so the three main digital objects that we have analyzed in the first part of the project, and the digital objects, thanks to which we have been designing our phase data maturity model, the same model that now we are using for the next generation of digital objects that have been produced in the second part of the project, and that we will be describing in full in our next and last deliverable by the end of September. So I prefer to leave also the reference to the work package and task within the project. So you can see from the work package through, we have a data set related to ecological and biological sampling into 5 research sites. So from the activity of biological sampling, so abiotic parameters, nutrients, biological communities and organisms, and so on and so forth, we derived, or our colleagues derived, a data set containing data on the selected indicators. From work package 3, we dealt with the human health indicators, and we dealt with the indicators populated with data coming from the public health databases that we were capable to access, also mainly thanks to our colleagues within the project. I can say that from one city to another, from one country to another, we have been experiencing different kinds of issues in accessing public health data sets. So it was it was not an easy job to find out even the one kind of indicators. Anyway, in both cases, so our activity came from public health databases search. So in one case, we had a list of health indicators. On the other hand, we had a list populated of data related to disease prevalence and causes of death, because with the especially with the PI of the project, Professor Maria Feio, we decided to focus our attention on 2 specific categories within the entire range of values and information that we could have. So on the one hand, we had a data set containing selected indicators. On the other hand, a data set containing human health data from research sites. And okay, so how to design a free data maturity model? Of course, we started from the analysis of the literature. And we have, as I said, already many models already available. FAIR-Assist, RDA, the Pistoia project, FAIR4Health, and so on, whatever. Anyway, in a free data maturity model, we have a set of indicators that are classified based according to some priorities. Some evaluation methods are defined, because the FAIR principles, we can say quite roughly, are more some qualitative concepts that we need to transform into quantitative elements, into numbers, in order to verify, to assess the compliance of the digital objects to the FAIR principle. We have to quantify what is a label, a basic label that will be our benchmark, and what can be the label we are supposed to get to. So in every free data maturity model, we always have 3 elements: the indicators, So the aspects of the fairness that are evaluated, the priorities, the relative importance of the indicator, and an evaluation method that allows us to the transition from the qualitative side to a quantitative side. In our case, we decided to deconstruct the 15 sub-principles, because we have 4 principles that are articulated into 15 sub-principles. For each of them, we decided to deconstruct them into the sort of a sum of a sentence and a tag. So this is our indicator for us. Specifically, the F1 indicator says, this states that data and metadata are assigned with a unique and persistent ID. So we deconstructed and said, okay, our sentence is metadata and data will be assigned an ID. Okay, but what kind of ID? So if we have a question, we will have some answers. Before this, we assigned a priority to these indicators, and also in this case, we leverage, of course, the main results from the literature. According to many authors, the F1 principles is considered as essential, so scored with a 3. In other cases, we have 2 as important, 1 as useful. So we have a list of priority from 1 to 3. As I was saying, if we have a question, we will have an answer. And we defined also 3 kinds of answers in order to have also a stage value from a minimal addressing to an intermediate to an optimal addressing of the question. So in our case, the minimal value is data and metadata are assigned non-persistent, non-unique identifiers, so the basic level. In the second case, identifiers are eternally persistent but not globally unique, or vice versa. In third case, so the optimal addressing, identifiers are globally unique and eternally persistent. So we made this exercise for each of the 15 sub-principles. This is an educational-based approach. And given that education is one of the 5 dimensions of the One Digital Health framework, so we can say that this kind of fair data maturity model is One Digital Health related. And the compliance, this activity, this sort of exercise of compliance of the digital objects with the FAIR principles must be done for each of the digital objects and must be done for each of the iterations that we are doing along the project. Shifting to the evaluation method, we came out with this FAIR score. There's a weighted average between the value stage and the priority. And the value of this FAIR score always spans between 1 and 3. And so you can graphically see, for example, our benchmark, our first iteration for the specific digital objects, tell us that in terms of reusability, the overall level is 1. In terms of findability, the overall level is 3, and so on. So this means that for that specific digital object, we need to improve the accessibility, the interoperability, and the reusability, because we already occur to have a high level of findability. And so a periodic survey was set to assess the compliance of the digital objects of the project with the FAIR principles. This is our graphical solution for our FAIR data maturity model. So here you see the sentence and the tag with the 3 levels of answer. You can see the priorities, so the priority of the FAIR principle, and the stage, so the level of the response that was given for that specific digital objects to the 15 sub-principles. And of course, the stage per se is not sufficient we need to provide an explanation why the score of that response was 1 or either 2 or 3. We need to explain that. And in the end, we will arrive to an overall score, of course. So here you can see for the 3 digital objects, the scores that we came up with and the overall score for our 3 digital objects. So you can see the total, so the average is not so high, is 1.6. We can appreciate a good level of accessibility and not good level of findability, interoperability, or reusability. But we are not here to judge or to criticize. We are just here to state, so far in the present moment, for the digital objects that we had and for the kind of digital objects that we had, this is our benchmark. So of course, this means that we can only try to improve. And here we can see the most important criticalities that we could register after our assessment. For example, for the findability, identifiers not globally unique or persistent outside the project scope. The indexing was only linked to the local project environments. For what consists the accessibility, the authentication, authorization were inconsistently applied, that the versioning policies were only mainly related to the kind of tools that we have been using. The interoperability was the weakest categories that we could register so far. So we had structured formats, for example, Excel. Anyway, we could not always have machine readable data and metadata, nor no proprietary representation, and so on. For the concerns the reusability, the comprehensiveness of metadata varied. They were not always in machine readable formats, so it hindered in some way the reusability. In many cases, the data were registered in the free text, so they were barely human readable, but certainly not machine readable, and so on. Okay, this was an important result that has become one of the most important steps toward the One Digital Health intervention. Also, in this case, let's get started with some definitions, of course. According to the literature, because we have been already publishing about One Digital Health intervention, this has been defined from the authors as a set of digital functionalities or digitalities designed and deployed to support specific initiatives that address human, animal, and environmental systems needs and challenges, that can assess the outcomes, either expected and unexpected, collect the related data as we have been doing so far, and One Digital Health intervention also features a selection of telemetrics based on the application of multi-criteria decision analysis principles. One Digital Health intervention is implemented to address One Health related challenges, to achieve some One Health important strategic outcomes, especially on the technological side, and to achieve a fair use of digital technologies. So you can see that One Digital Health is not only an academic exercise that can be seen outside a One Health sphere. No, a One Digital Health intervention only exists if there is a One Health intervention lying in your region. And when we speak about digital functionalities, we speak about all those technological disciplines that can be deployed in a way or another in order to address some needs. So this is what is a functionality. a way to address some need. A digital functionality is a digital way to address some digital needs via the use of some technologies. And you remember the technology ring within the One Digital Health framework, so you can see the dots that are connecting crumb by crumb. The peak of the One Digital Health intervention is what we call One Digital Healthness. It is a sort of a number, but not only. It is the main criteria that can allow us to understand an overall measure of how much and how well the harmonization, the balance between the different digitalities works to address the needs and challenges that come with a One Digital Health intervention. And as we have been said so far, the technological part is a crucial part of all this process, all this phase, so to speak. The thorough methodology lying under the One Digital Health intervention was explained into deliverable 3.4 that was submitted by the end of 2025. And it consists of 6 main points. A use case definition. So what are the steps, what are the actions that make up the intervention? The fair data maturity model, remember? How fair are the digital objects that are involved? The assessment of the relevance of these digital objects. Okay, I have these digital objects, but how important, if any, are within the economy of the situation, the project in this case, I'm dealing with? The design of the model using the principles of multi-criteria decision analysis. And then we'll see the target, because we are arriving to our final outcome arithmetically and also graphically, and in the end, the ODHness calculation, both geometrically and graphically. Okay, this is our fair data maturity model, so I will be skipping that. This is our digital objects relevance assessment tool. As I said, we needed to understand the capacity for each digital object to provide an effective contribution to the overall advancement of the research activity as an actionable knowledge unit. Our digital objects have to help us to improve our knowledge of the context, the scenario, the field, the arena, or whatever we are working within. So do not be scared about that. I've been designed that, I have been solved for you that, but this expression was needed to cross the importance of the fairness principles within the importance of the single principle, and the importance of the single principle crossed within the general importance of the fair principles. Well, it is much more complicated than this, but just to give you a first idea. What's important is that I need to calculate for each of the fair principles the weight of them. So W with F, with A, with I, with R. So the overall relevance is the sum of these 4 bad things. So the total relevance, and you can see here the final scores. The relevance spans from 0.7 to 2.2. So we were capable to divide this overall interval into 3 sub-intervals. From 0.7 to 1.2, we can state a low relevance of the digital object within the economy of the project. An intermediate relevance if R with I spanning between 1.2 and 1.7, and from 1.7 to 2.2, and high relevance. And so far, we registered a low to intermediate relevance of the digital objects that we analyzed. Repeat, this is not a critique, just a statement. And this means that we can only improve. What's important now was we need to understand we are within a giant project. So we needed to work on the narrative of the project. We needed to shape the project as a giant, a big-sized use case articulated in a sequence of steps in order to transform into a one digital health use case articulated in a sequence of steps. So leveraging many methodologies from the literature, we studied the entire, we took the proposal of the project and we distilled the narrative, the story behind the project. So you can see only just one part for the sake of the space and comprehensiveness, the understandability of the slide. We created our project storytelling. Here you can see the third and the fourth steps. And we gave a title and name to each of the steps. So we defined the main objective of the steps, the main activities, the work package in charge, and so on. Then we defined what we call the ODH score, the performance of the project related to the specific activities, the ODH performance. So you remember the 5 dimensions of the One Digital Health Framework. We have citizen engagement, C, education, E, medical, human and veterinary healthcare, M, industry 4.0, I, surrounding environment, S, so Chinese sort of acronym. As an expert, we try to understand the compliance of each of the activities to the each of the 5 dimensions of the One Digital Health Framework. And we calculated an overall ODH score. So each of the scores spans from 0 to 5. The sum divided by 25 gave us the ODH performance of that activity. Then we have the fairness level. We took this from the free data maturity model, but not only, it was necessary to understand each one of the digital objects that we have analyzed, in how many health-related domains they fall. They fall into just 1, into 2, or into 3 health-related domains. In our cases, the 3 digital objects, each of them falls into 2 health domains. The first one into the environmental and animal, S, surrounding environment, and A, animal. The second one falls within the human and the environmental domains, and also the third one. For each of them, we have defined the digitalities. Okay, what are the disciplines, the digital disciplines that are considered? Ecology, public health, biology, environmental health, and so on. Okay, what are the digital technologies through which the disciplines are involved? This is why digital functionalities. What digital need are we going to address with our technologies? LLM, production suite, shared space, digital maturity evaluation, and so on. And so we had here on the farthest left, we have the One Health side of this matrix. Also, this matrix was already published, so it is something that we did not invent or design for the project. It came from before, or prior than the project. So here we have the One Health side, and we have the One Digital Health performance. And then we smoothly shift to the One Digital Health side. So we have the fair compliance. So the problem was how are we going to cross? How are we going to create an intersection, because these two different kinds of criteria. And then we decide an ODH amp, an ODH amplification, so a specific function of the One Digital Health performance and the fairness level that allows us to quantify how the fairness can amplify or limit the One Digital Health performance. So here we have the One Digital Health performance. And through this, we can understand if and how these results can be further amplified or conversely can be limited. So I save you from, also for the sake of this, the time, save you from all the multi-criteria decision analysis crude part, and we shift to the end. This is our target. This is divided into three parts, of course, because we have the three health-related domains. So the digital functionalities related to the human health are called the digital humanities. The digital functionalities related to the animal side are called digital animalities, and so the same digital environmentalities. So we placed for each of the digital objects some dots in this target. And if a digital object fell in just one health-related domain, we would have had just one dot. In case of a digital object falling into two domains, we will have two dots connected by a segment. In case of a digital object falling into all the three health-related domains that we call a triality, we will have a sort of triangle. And this is our situation. We had three digital objects, each of them falling into two different digital health domains. So we have two segments that connect the human side and environmental side, and one segment connecting the environmental side and the animal side. These are the disciplines that are involved, and I had already reported them into the conversion matrix from the One Health to the One Digital Health. We calculated these numbers and the value of the coupling function that allows us to connect the One Digital Health performance and the fairness level. We were able to geometrically place in space the center of mass of this dot, and you can say it's translated into the One Digital Health target. So far, in the first part of the project, based on the number and the kind of digital objects that were produced in the project, the digital healthness was still skewed by the environmental, heavily skewed on the environmental side, because it is not only in this, but it is very far from the center. So the higher the value, the farther from the center. So our objective is to get there. How? Having digital objects that are as fair as possible. And we can do this strategy, you can see on the left part of the slide. Improve fairness compliance of already existing digital objects, the verification, and or assessing the compliance with the FAIR principles for new kinds of digital objects. And I can anticipate you that we have both, because the existing digital objects have been in their shape, in their form, have been improved in another version. They have been translated into a Zenodo data set. So now we are going to assess the verification, so the improvement in the compliance with the FAIR principles. And we have also the FAIR data maturity model that was filled from our colleagues related to new kinds of digital objects that have been designed created and implemented in the second part of the project. Okay, so One Digital Health Intervention is part, and we will see, of the broader perspective, what we call One Digital Health ecosystem. What is this? Here, a complex and interconnected galaxy of human stakeholders, animal networks, environmental sensors, and computational agents that operate as a unified world to co-create a systemic value. Starting from the position paper of One Digital Health in 2021, we were able to find different kind of results coming from the implementation in different ways of the potentialities of the One Digital Health framework. And so far, we were capable to find out six different kinds of results. One Digital Health Intervention, of course, is one of them. So we thought that it was now the moment to understand if and how these different kind of results could be considered as pillars of a broader vision, a broader ecosystem. So here we have the framework. The One Digital Health Intervention, what's its scope? Deploying targeted digital actions, the digitalities, to manage concurrent ecological and health crises. So here you can see what are these perspectives and dimensions of the framework that have been mainly involved in designing and deploying the One Digital Health Intervention. This does not mean that the gray layers are not part. Simply, the blue layers are those that we can appreciate as more directly involved. This is the joy of the main publication so far related to the One Digital Health Intervention. Then we had the chance to find connections with another emerging discipline within the wider umbrella of biomedical and health informatics, that it's called accidental and emergency informatics. We have been talking about this in the paper related to One Digital Health Intervention, but we have been also publishing a specific paper related to the main principles of the accidental and emergency informatics and the integration with our framework. So the scope is embedding acute real-time hazards into informatics and situational awareness into public safety networks. And so here you can see the main layers that have been involved. The 3D maturity model, of course, we were able to publish it, to present it for the first time into the FME Special Topic Conference 2025 in Osnabrück. And the scope, you have been seeing this, is enforcing machine actionable data sharing standards to drive automated and also AI-ready data governance. We have, of course, started to think in terms of next-gen indicators. And this is something that also the same OneAquaHealth project was sort of demanding. If we have to deal with the One Health under a new label, an upper label, which is One Digital Health, this means that the already existing indicators related to public health, public safety, into the human, animal, environmental side, maybe could not be reliable enough to address these new kinds of objectives. So we have been starting to think in terms of a new class of public digital health indicators. We have submitted a first paper of this kind to the IMIA yearbook, International Medical Informatics Association, the yearbook of 2025. Unfortunately, from some internal issues, the yearbook of 2025 was not printed yet, but we hope that it will be published as soon as possible. The link reference architecture we were capable of design a cloud edge architecture based on IoT principle, through which the principles, the potentialities of the One Digital Health framework were tested into real use cases, and we were capable to test it into a human side, a human-based and environmental-based use cases. So the same architecture that was articulated into two different health-related domains based on the principles of the same framework. This means that framework works. And we call that link all. And you can see it was published in 2026 in the Health Informatics Journal. Last but not least, One Digital Health unified terminology. This is why I wanted to create a specific chapter about that. And you can see that this terminology really spans through all the layers of the framework in the same way. If you are creating a new framework, if you are creating a new research path, you need a terminology, you need a language that leverages the already existing languages related to the already existing vocabularies related to the human related science, so not only the human one, but also the animal and the environmental one, and it's capable to create its own internal and consistent ontology and terminology. And in fact, let's go through the end and just focus a little bit of attention of this unified terminology. So, an effective combination of what's underscored so far, so digital object, 3 data maturity mode, use case, One Digital Intervention, and so on, demands for a shared language. I cannot just borrow from different scenarios. I need at a certain point to create my specific terminology that is capable, of course, to mirror, to resemble already existing ones, and it's capable to interface, interact with the existing ones' terminologies. So we have the framework. We have been starting to connect some find the ontology, the hierarchy, to the hierarchically organization of these concepts, and deploying it via specific programs, specific logics that are related to the ontological sciences. And we have been capable of the DOI that I already showed in one of the previous slides. We started to publish first outcomes of this that consider the data sources, the inclusion criteria, the curation processes, the benefits. So we are dealing with all the necessary steps, ontological and terminological steps, in order to create our sound, consistent, and recognizable terminology. For example, you can see these are the two keys, One Health and Digital Health. You can find some recognizable synonyms, as in SNOMED, for example. You have the original term, and you have the preferred term, and you have the accepted synonyms. And for each of them, you have a definition and an explanation. We have done this from this is just an example, of course, for the two keys, the 3 perspectives, and the 5 dimensions. So this means that it's a work that is on, live and ongoing. So the importance of a unified terminology is critical to better communication and collaboration between the health-related domains, the benefit to improve the outcomes, monitoring, and decision-making for the patient considered as the entity that needs cure. It is the ecological entity, the environmental entity, the human entity, or the animal entity. This is a limit that we need to overcome, especially in the biomedical and health informatics community. The implementation potentialities, and of course, the future potential, to unlock the potential of digital technology in order to empower the citizens, to empower the veterinary side, to empower the ecological, the environmental-based side. Okay, I think that it is now so far as what was great. I was into the 60 minutes that we defined in the region. So, okay, this is the Q&A moment.
If you have any questions for Oscar, please feel free to ask them.
So first of all, thank you very much, Oscar, for a very interesting update. Great capture of the work you have been done so far. Congratulations. On the unified terminology, which you have mentioned at the end, is this something which at what stage it is in terms of?
Well, it is an initial stage because we, as said, we need to really care about the ontological side. So we need to understand define, design the basic rules of what are the concepts, the main concepts that we need to connect in what way. So it's not just an easy connection, but we need to understand the different kind of ontological connections, if any. We need, as said, we need to understand inclusion and exclusion criteria, and to define these original set of rules in order to understand if and how a novel term, a novel expression can be part of the basic set of terms to define, to address a specific problem, a specific situation, instead of using just a combination of existing terms. So it is not an easy step. Of course, as in anything, we do need time, we do need resources. So we are into an initial stage. Still, it is an interesting one. When we will come to a more robust stage, of course, we can think in terms of how to implement it by a specific tool in interface with our specific tools related to HL7 or and so on. But we are still quite far from this. We need to strengthen, but we can see already now the potentialities of this. Thank you for your question.
So the follow-up question is, you are not looking at the unified terminology just for OneAquaHealth, but you're looking for a larger universe, right?
Yes, because it comes before OneAquaHealth. OneAquaHealth was really important, was critical for One Digital Health because it allowed for many of the seminal elements of related to the framework to come to life, to become actual. First of all is the One Digital Health intervention. So it allowed us to shift from theory to practice for some of the pillars you have been seeing, but the terminology was already in its infancy before it, as it was link call. In fact, we were capable also to apply link call to different use cases than the sole OneAquaHealth. So we had some potentialities. OneAquaHealth allowed us to bring some of them to life.
All right. Thank you.
Thanks, Dave.
All right. So if there are no other questions, I would suggest that we move towards the end of our webinar. This is where I would like to invite you to visit our Open Information Hub. This is our project platform in order to exploit further networking opportunities and also receive information on the next planned learning sessions or webinars concerning our great initiative, OneAquaHealth IEEE Hackathon. Get in touch with us via our Twitter, Facebook, and LinkedIn project channels. We're planning, of course, many other exciting events and webinars, and we will be happy if you're part again of them. So thank you very much, guys. Thank you very much, Oscar, for the great presentation, and wish you a nice rest of the day. Thank you.
Thanks to you.
Thanks, everybody.
Bye-bye, guys.
Bye-bye.